Hi, my name is Bergen Shelby, and my presentation is over the medical response to the Joplin tornado. On May 22nd of 2011, at 5:41 p.m., a tornado struck Joplin, Missouri. The tornado winds were estimated at 200 miles per hour. An EF5 tornado, initially a half a mile, expanding to 3/4 of a mile wide, traveled on ground approximately 13 miles. Here is a picture just showing all of the damage done from the tornado. This created a major impact on the city. There was a total of 7,500 residential dwellings in the city were damaged or destroyed by the storm. More than 17,000 people were affected by the tornado. Of the 7,500 dwellings, approximately 4,000 homes were destroyed, causing an estimated 9,200 people to be displaced. There were also 1,308 pets displaced by the tornado and taken to emergency pet shelters. Approximately 30% of the town was in ruins. However, many agencies stepped in to help out. More than 13 federal agencies supported the critical emergency need. More than 820 FEMA employees worked the response and recovery efforts. Federal, state, and local officials teamed up with the Independent Living Center to serve as a resource for individuals with disabilities. As you can imagine, the cost of this disaster was enormous. FEMA spent nearly $150 million to help remove debris, provide emergency protective measures, and to permanently repair or replace buildings. FEMA also provided more than $341,000 to cooperation of national and community service for assistance from AmeriCorps to support local and state authorities. More than $21 million in grants were approved for the Missourians to help pay for home repairs and temporary housing. The total losses added up to over $2 billion. The mortality of this disaster was also very large. There was 161 lives that were lost due to the tornado. It was said to be the single deadliest tornado in the U.S. since 1947. There were 3 major hospitals that stepped in. The first was St. John's Hospital. The hospital was completely incapacitated by the tornado. There were 188 patients at the time of the tornado. 5 patients and 1 visitor were fatally wounded. The remaining 183 patients were evacuated within 90 minutes. Here's a picture of the St. John's Hospital, and as you can see, it was also destroyed by the tornado. The Triage Center's medical response. The St. John's Hospital medical staff and supplies relocated to Memorial Hall. Multiple triage centers spontaneously developed at schools and intersections along the damage path. The critically wounded were transferred to Freeman Health System. The Freeman Health System provided a great medical response to this disaster. There were 467 registered patients treated within the first 12 hours, and as many as 250 were unregistered. 11 fatalities and 64 transfers occurred at the Freeman Health System. There were 888 at Freeman, and more than 100 non-Freeman clinical staff reported Sunday evening. Several volunteers came out to help out during this disaster. More than 1,200 patients with tornado-related injuries were treated within 48 hours. There were many challenges and concerns concerns that came along with this big disaster. There were limited communications due to no cell phone service or pagers. More than 200 patients were in a 41-bed ER functioning off of emergency generators. There was a concern with how clean the equipment was and the lack of supplies with so many people, and there were also contaminated wounds that didn't have antibiotics. They were running low on medicine and equipment, and it was also hard for them to identify unresponsive patients. With there being so many patients there, they ended up just like having to put a piece of paper and write on the paper to identify the patient. The principles of the National Response Framework. Every available agency and resource was developed to assist in response and recovery. Home improvement stores delivered relief and cleanup supplies. They partnered with a commercial airline to fly in volunteers. Utility companies teamed up to restore power to the area. Telephone companies provided wireless equipment to local emergency officials. The cultural, behavioral, religious, and political frameworks. As you can imagine, there was a lot of post-traumatic stress and depression that occurred after this disaster. People suffered from having lost their homes and loved ones, and just seeing all of this disaster that it had happened, and it really hurt all of the people in the whole city. The city came together to make it through this hard time, though, and several churches were destroyed. However, they were able to hold outdoor church service. And here's a picture of one of their outdoor services that they held. As you can see, all the debris and houses that were destroyed in the background. However, they were still all coming together and having church. There were many ethical issues during the disaster. There were issues with the overcapacity in the hospitals, with there being so many patients that needed to be treated, and trying to figure out which patient needed to be treated first, and with there being not that many staff. But thankfully, to the people that came and volunteered, they were able to really treat the patients well. There were also not enough supplies and not enough clean supplies and medicine. They couldn't identify all the patients. They lost health records. However, they had practiced repeated disaster drills that allowed them to evacuate the hospital in 90 minutes. And as a result of this, training should be mandatory for all medical students and residents so that they can all be aware and prepared so they can be able to face any kind of issue, any kind of disaster, and be able to overcome it. The vulnerable population that was affected was the elderly, the infirm, and disabled. However, the AAAs and the senior centers assisted in locating the vulnerable populations, and they were able to check on people that might not have anybody else that were checking on them. The impact of the media was huge. They documented the disaster by taking photos and videos. Phone communication was out, and however, people were able to still get on social media and post that they were either okay, or to get the word out that their homes were destroyed or their loved ones were missing. The media also gave advice on where to go or how to give help, and the media helped recover lost items such as pets and hospital records. Since the disaster, Freeman Health System has increased its capacity. 4 task forces were created to address debris removal, housing, and critical facilities such as fire stations, hospitals, and schools. About $465 million went to building the new Mercy Hospital, which opened in March 2015. Homes, businesses, and government buildings have steadily been getting rebuilt along with new businesses that have came into the area. So since the disaster, Joplin has really came a long ways with recovering and rebuilding everything. The lessons that they learned were that they need to improve warning communications to convey a sense of urgency for extreme events, to collaborate with partners who communicate weather warnings, to develop a GPS-based warning communications, including the use of text messaging, smartphone apps, and mobile communication. Collaborate more throughout the weather enterprise to ensure that weather warning messages through the use of television, radio, and other use of media, and to continue to increase community preparedness. And those are the references that I used. Thank you.